Hi, my name is Kannika. I'm going to do the video giving IM and sub-Q injection. For the IM injection, there are three injection sites. So it's gonna be on the deltoid. So for the deltoid, you are going to first find the landmark. So you're gonna find the acromion process right here, and then you're gonna put 2 to 3 finger down depending on how big your finger are, and then you're gonna find a muscle right here, little juicy right here, and then your injection is gonna go right here. So when you give your injection, you're gonna use your hand, and then you're gonna pull the skin outward, and then your injection is gonna go right here. We're gonna use the Z track technique on this one. And then next one is gonna be ventrogluteal. For that one, you're gonna first position your patient. So your patient gonna be on the side with the hip up and then the knee flat. So for that one, you're gonna put your palm on your greater trochanter, and then your thumb is gonna be on the groin, and then your index finger going to be toward your iliac spine, and then your middle finger gonna be toward iliac crest, and then it's gonna be like this, and then your injection is gonna go right in the middle between the index finger and the middle finger. And then for the vatus lateralis, that you're gonna position your patient in the sitting position or supine position, and then you're gonna use your left hand like that, and then you're gonna put your hand on above the patella, a little bit above patella, and then for this one, you're gonna find the greater trochanter, and then you're gonna put the right hand and then a little bit below the greater trochanter, and then you're gonna form your hand like this, and then your injection is gonna go right in the middle. Okay, and then for sub-Q injection site, so it's gonna be the outer posterior aspect of the upper arm, and then is another one gonna be the abdomen below from the costal margin to the iliac crest, or the anterior aspect of the thigh. So those are the three, and the best sub-Q injection would be the abdomen side, because that's where there's a lot of fat, and then it will be the best side. Okay, so I'm gonna start my procedure right now. First, I'm going to sanitize my hand. So, and then look at my medical records. Okay, I have my patient Anna Pawlowski, date of birth May 5th, 1957, and then I check my doctor order. So I have doctor order for Anna. So I have influenza vaccine 0.5 IM, 0.5 ml, give it IM, give it once to prevent the flu, and the time is now. Documentation need to be done. And then B12 500 micrograms sub-Q, give it once a month, and the time is now. And also documentation need to be done, so I'm gonna compare with my mom. Okay, Anna Pawlowski. Alright, influenza 0.5 ml IM, give once to prevent flu. The time is now, everything match. Okay, I have Anna Pawlowski and B12 500 micrograms sub-Q, and then I give it once a month. The time is now. Okay, my doctor order and Mars are matched, so which is good. And then I'm going to check my. Now I'm going to retrieve my medication. So this is when I'm going to do my first check for my medication. So I have B12. So I have Anna Pawlowski B12 500 micrograms sub-Q once a month, and the time is now. Document need to be done. Okay, everything match. And then for this one, I have Anna Pawlowski influenza vaccine 0.5 ml IM once. Give it once to prevent flu, and the time is now. Documentation need to be done, so everything match. So check expiration dates. Okay, these are not expired and they have not been opened. Okay, so I'm going to consult my med cards. So for my B12 is for anemia. So for the nursing implication, I have to assess the sign and the symptom for B12 deficiency: pallor, red inflamed tongue, pale gum, and then look at the conjunctiva of the eyes. And then how would I know the med is working? So the patient will not show the sign or symptom of B12 deficiency. And then the side effect that I need to be aware of. So anaphylaxis, red urine, erythema, rash, or restlessness. And then patient education. So I give the education that food that high in vitamin B12, tuna, beef, and clam. And then for the influenza vaccine for the flu, help to is a vaccine to prevent the flu. Then I need to monitor for the sign and the sign of allergic reaction, so rash, laryngeal edema, or wheezing. So how would I know the medication is working? So patient will not show the sign or symptom of flu. And then the side effect that I need to be aware is headache, malaise, pain, soreness, sore throat, fever, and nasal congestion. And then calculation. So for the look at it, my medication need to be calculated. So influenza is, I have the supply 0.5 ml. So this one comes in a single dose, which is 0.5 ml is my prescribed dose. So I don't need to calculate this one. But for the B12, supply is 1,000 microgram in 1 ml, but the order is 500 microgram. I need to calculate this one. So I'm gonna calculate it. So D over H by Q, and then 1,000, 500 microgram, 1 ml. Okay, so for the B12, I'm gonna be giving 0.5 ml to get 500 microgram, and this is my calculation. Oops, again, get to my med cards for B12. I mean for B12 and this is influenza. Okay. Okay, so next I'm going to select the syringe and the needle for my injection. So for the IM injection, I'm going to use the 3 ml 22 gauge 1.5 inch needles. This is for my IM, and the package is not expired. And then for my sub-Q injection, I'm going to use the 1 ml 25 gauge 5 by 8 inch needles. And then this is not expired. I'm going to do my second check now before I prepare my medication. So I have anaphylaxis and influenza vaccine 0.5 ml IM, give once to prevent the flu, and the time is now at 2 o'clock. And then documentation needs to be done, is match. And then my second medication is B12, 500 micrograms sub-Q, give it once a month, and the time is now 2 o'clock. And then documentation needs to be done. Okay. Alright, okay, I'm gonna start preparing my medication. So I'm gonna do my flu shot first. So technically I'm gonna have my new alcohol pad, but I'm out of it. I'm gonna use this one. Okay, so I have I'm gonna open my flu shot. This is the single dose. So I'm going to clean the rubber stopper for about 20 to 30 seconds. And then I'm gonna leave it there so I know this is has been cleaned. Alright, I'm gonna use my 3 ml 22 gauge syringe. Alright, attach it. and then exercise the plunger for a little bit, and then pull back 0.5 ml as prescribed. Okay, rainbow. Then carefully, and then inject the air inside the vial where all the air on the top, not in the solution. Then you invert it, invert the vial, and then pull back 0.5 ml. You can pull back more than that, and then you can put it back, but make sure that you get 0.5 ml. And then if you have bubbles, make sure that you don't have bubble inside. So I don't have any bubble. Okay, recap. So this is a single vial, so single dose vial, so I can throw in the biohazards. And then label my syringe. So Anna Pulaski, influenza, IM 0.5 ml, 6:15, time, and my initial. This one's done. Okay, my B12. Okay, this is B12. It is my it is a multi-dose vial, so when I first open it, I need to put the date, the time, and initial. Okay, that. Open it and then clean it for 20 to 30 seconds with alcohol pad. And then leave it there so I know I cleaned it. And then I use my subcu injection syringe and needle, which is 1 ml, 25 gauge, 5 by 8 inch. Peel like banana peel. Okay, exercise your plunger. Pull back 0.5 as prescribed. Okay. And then carefully inject the air in the vial where all the air on the top. Invert the vial. Pull back 0.5 ml. Make sure you get 0.5. Okay, got 0.5. Make sure you don't have any bubble inside the syringe. Scoop method. So this one is a multi-dose vial, so keep it for next time, and it has been labeled. So I need to label my syringe. And a Hawaski B12, 500 micrograms, 6:15, 2020, and then the time is 4 o'clock, and then my initial. Okay. Alright. So now I'm ready to go to my patient room. So let me gather my supply, my medication, glove, 2 gauze, and then my alcohol pad that I have here, and then my hand sanitizer, and then my medical records, and then in the room is gonna have a sharp container inside. Put the patient's on. Oh. This is my patient's. Okay. Hey, Amy. No. Come on in. Wash my hand. Hi, my name is Kannika. I'm going to be your nurse today. Can I have your date, your name, your date of birth? Anna Hawaski, May 5th, 1957. Okay. Armband and okay, everything match. Do you have any allergy? Penicillin. Okay. Armband, penicillin. Penicillin. What was your reaction to penicillin? I have rash and hive. Okay. Okay. All right. Everything match. Today I'm going to give you medication. I have 2 injections to be given to you. So one is gonna be a flu shot. It's gonna go on your upper arm right here, and another one is going to be your B12 for your anemia. It's gonna go into your abdomen. Do you have any question? No? Okay. All right. So assess the safety patient. So 2 sliders up, and then here's your call light, and then the bed is locked. Bed in the lowest position, and then there's no spill or clutter on the floor. I'm gonna close the curtain to give you some privacy while I give you injection. Alright. Okay, going to set your arms for your injection. Okay, I don't see any allergic reaction, so your arm's good. Okay. Alright, so I'm gonna inspect your abdomen, so you don't have any sign of injury in your abdomen. That's good. And then let me see your gum. Let me see your eye. Okay, there's no sign of hair. That's good. Alright, so I'm gonna give you a little bit of education about medication that you will be getting. So for influenza, you have a flu shot, and then that's gonna prevent you to get a flu. And then if you have any sign or symptom of headache, malaise, pain, soreness, have sore throat, running nose, just let me know. And then for the B12, that's for your anemia. So that's gonna help with your anemia. And then if you have any sign or symptom of red urine, erythema, rash, and you feel tired, just let me know as well. And then food that have high in vitamin B12 will be tuna, beef, animal liver, or kidneys. You have any more questions? So good. Okay. So I'm gonna position you to be ready for the injection. So you want the right arm or the left arm? Right arms. Okay. So be right arm right here. Just relax your arms. Okay. Now I'm going to do my third check. So here I have Anapawaski B12 500 microgram sub-Q once a month, and the time is now, and then documentation will be done after medication been given. And then I have Anapawaski influenza 0.5 ml IM, and then the give is 1 to prevent the flu, and then the time is now. Documentation need to be done. All right. So I'm gonna scan the medication, scan the armband, scan second medication, scan the armband. Okay, everything match. Relax your arm for me. Okay, so find my landmark for the deltoid. Okay, it's gonna be a chromium process. All right, 2 finger down, and right here's my injection going to be. Clean the injection outward for about 15 seconds, and then let it air dry. So I put right here so I know my injection will go right there. So I get my flu shot. All right, use your hand and then pull the skin outward, and then go 90° down, and then slowly inject the medication 5 to 10 seconds using the C-track technique. All right, pull it out. And then cover with the gauze and don't massage. Then we scoop with the, okay, put it in a sharp container. Is it okay? All right, I'm position patient in supine position to give the abdomen for the sub-Q in the, on the abdomen area here. So that's it, it's good, relax. So clean it outward again. All right, let it air dry. Okay, so for this one, you're gonna pin the skin up 1 to 2 inch, and then you're gonna go 90-degree down. So my patient has, it's not a thin person, I can go 90-degree. So slowly, 5 to 10 seconds down. And then, all right, put the gauze there, and then in case the safety of the needle, re-scoop it, and then put in a sharp container, and then clear my waste, medical waste in the biohazards. Are you still doing okay, ma'am? Yes, okay, take out my purse, biohazards, wash my hand. Okay, so, and then document my assessment that my injection, so sub-Q was given in the abdomen side, and then the flow shot given on the right deltoid, and then document has been done. And then check my check patient safety. Okay, 2 side rails up. Here's your call light, and then your bed in the lowest position, and then is locked. The bed is locked, and then there's no clutter or any mess on the floor. Okay, I'm going to open the curtain back for you, then you can see the view outside. If you have any question, you need anything before I go? No, I'm good. Okay, if you need anything, just let me know. And then wash my hand. Okay, done. Okay, that's the end of my video. Thank you.